Make it okay to talk about all things menopause. We cover the clinician side, the medical side, lifestyle, how it intersects with work and all of us in our professional careers, and also the mental health side of this time of life. I'm Melanie Olson. I'm the community director here at Gennev, and I'm also in perimenopause. So I'm going along this journey with all of you. And today we're going to pull back the curtain a little bit more on misconceptions. Some call them myths, misinformation. We hear a lot of it in the field, in our work, and in the Gennev community on Facebook, but also in the world around us. Today, I'm so pleased to introduce and bring to this broadcast, I know y'all have met her before, Dr. Yakisha Dooley. Dr. Dooley is a Harvard-trained OBGYN physician, a fellowship-trained surgeon, and a women's health menopause expert. Her mission is to help women advocate for themselves and their health through the perimenopausal and menopausal period. And as a wife and mom, she understands the critical role that women play in their families and in their communities. And isn't that just the truth? She believes in whole body health that optimizes a woman's quality of life. Welcome, Dr. Dooley. Thank you so much for joining us today.
Absolutely. Thank you for having me.
Absolutely. Well, we wanted to bring you on today to bring some of that evidence-based treatment and discussion to the table. There is one of the, it's so important that we recognize through all of our journeys, it's personal. We all have different ways of handling our menopausal journey. And so wanted you to, if you could just start us off with some of the misinformation and the myths that you hear in your world, and from the doctor's perspective, if you can kind of shed some of light on that for all of us.
Yeah. So I think that one of the biggest myths is that you can't do anything or it's too late, right? I have a lot of women are like, well, my doctor said I just have to deal with it. This is just the natural part of my life. And, I just have to kind of suck it up almost. And I just think that is so sad because there are lots of things that can be done. And it's nice, even if women don't want to use any medications at all, just to allow them to be better advocates for themselves. And sometimes that's just about hearing them and talking through what are the different ways that they can just have a better quality of life, right? And that a lot of times it can just be even without medications, but how can we help you get better sleep? How can we help you be able to deal with the stress that's going on in your life? How can we help you just feel better in your skin? And for some women, they're like, I put on this extra pounds and I'm not sure what's going on. And now I feel bad, or my bones are aching, my back hurts, right? And so I want to get to the gym, but I don't feel good, or I wake up tired and I can't get to the gym, right? So it's really about what are the things that we can do to optimize your health and to help you feel better with and without medication, because medication is not required, but it is an option. I want you to know what those options are.
Yeah, that's so important. And I, as a woman, I really am feeling that importance of developing our advocacy muscles and really learning how to bring that up and bring ourselves into the equation. It's interesting how it's pretty tough for a lot of us to do
Yeah,
that.
it is. Well, and I think if you don't feel comfortable or if you don't feel knowledgeable, or sometimes people just feel like, well, my doctor would know. And if my doctor didn't say it, or if my doctor told me something, that must be the only answer. And so you feel like it's hard to make a comment or say something when you feel like your doctor is either not listening, or you feel like your doctor has kind of shut you down, or sometimes you're in the doctor's office and you feel rushed, right? You're like, I didn't have time to tell them all the things that were going on. And so all of those make it very hard to be able to advocate for yourself. And so it's like the more information people have, the more you feel comfortable speaking up. And sometimes what you need to do is like search out another doctor, but sometimes people don't even feel comfortable doing that. You're like, well, this is the doctor that delivered my kids and I've been with them for so long. I feel bad. I feel guilty, right? And so it's like you have permission to get whatever you need. And if you are with a provider that's not giving that to you, at least explore what else is out there, right? And I think that's one of the great things about Gennev is that we don't replace your doctor. We allow you to stay with your primary care doctor or your gynecologist, whoever delivered your babies, who you have a great relationship with and you feel like has really been with you for the past however long. And we can just really supplement whatever is going on, right? And that's what we are about. We're not going to replace, we're going to supplement. We are going to work alongside your doctor, your health provider, whatever, and just help get your questions answered. And work with whoever you are with to get you the health and the wellness and the feeling that you deserve.
Yeah. Last week we were talking about it's a team, and you got to look at it like that. Like maybe if
Yep.
if you're creating a team for yourself, you've got this and this that helps with this. But, for
Mhm.
menopause and from other specifics, it really make it for lots of things. Just I've been thinking about this concept. It matters who you're working with. Someone
Mhm.
who knows will cut the fat, get through it, and help you get through to the next side or the next stage of the next side, as we should say. It's so critical that we look at it that way.
Yeah.
Well, in the Facebook community, everyone, and hey, please put in your questions for Dr. Dooley. If you've got anything, we're watching chat. We'd love to answer along the way while during this conversation. But we wanted to bring out some of the things that we hear a lot in the community, a lot outside in the world, and bring them to light. One of the big things, and you touched on it a little bit, Dr. Dooley, was people wanting to do this naturally, wanting to work through menopause and their treatments and all of the things naturally. And could you kind of talk a little bit more about what it means to do it naturally? And
Yeah.
nothing wrong, nothing wrong. I didn't mean that to be like naturally. I love natural too. I'm
Yeah.
a total, yeah. So
Absolutely. Me too. I am always telling patients, like, I want to listen to you first and tell me what are your goals, right? And so when you're telling me natural, that actually means a lot of different things to different people. And so I never make an assumption of what natural means, right? And I always tell people, there are marijuana is natural, cocaine is natural, but that doesn't mean that that's necessarily what you want, right? So I'm like,
yeah,
tell me when you are saying natural, I don't want to make any assumptions about what that means. So in your own words, when you're saying, I want to do things more naturally, what does that mean? Because once I have a better idea, a better framework of what you want for your own health, then we can customize a plan, right? And so that's like a great way to start. And for some people, natural means I don't want to use medications, but I want to maybe use supplements, or I want to be able, figure out how to better my sleep. But by doing it with, I don't know, maybe meditation or yoga, for them, that's like natural, right?
yeah,
Or I want to be able to exercise more and I want to get natural endorphins from my own body because I'm exercising or because I'm sleeping better, right? And so I think that's one way to view natural. And then some people think if it's more plant based, that also for them is considered natural, but they're getting some of their plants maybe not just in food, but they're looking at like supplements, right? And so everybody's version of what natural is can kind of vary, right? And even some people will
mhm,
say, if I am using something like Premarin or something that comes from, horse urine, I consider that natural. It's coming from an animal. It doesn't have a lot of like other things, right? And so that's why I always tell people, like, tell me when you're saying natural, what does that mean? What does that look
mhm.
like for you? How do you want to feel? What are the things that you're okay using or doing? And what are the things that you're like, I really don't want to do this or talk about that right now? And then that gives us a guide as to how to move forward.
Yeah, yeah. And it's so important too to bring up the lifestyle piece to this. I mean, as someone going through Perry, I work with an RDN with Katie at Gennev, and she's just such an amazing health coach. And for my work and all this, and I do call it work because it's me investing in myself.
Yeah.
Lifestyle's huge, and that's the most natural thing we can do.
Yeah.
Shore up that exercise regime, start adding, whatever. I've been doing strength training, and it's so hard for me to get out the door every single day. It really is so hard. And then every day I'm like, that was so awesome. I feel so good
Yeah.
after. But I just am amazed at how difficult it is for even just after all this evidence, it's still
Mhm.
hard for me to get out the door, So, but just wanted to kind of bring that up too. And what are your thoughts around that?
I think that it is, right? Especially in the perimenopausal and menopausal period, just like anything, it's one thing to know what works and what's going to make us feel better. It's another thing to actually do it and to commit to doing it and doing it every single day, which is where the benefits are. You can't just do it once. It's like, how am I going to make this a part of my lifestyle
Mhm.
now and forever? Because that's when you're going to see real results. And it is hard, especially for perimenopausal women or postmenopausal women when you're not sleeping all night. It's hard to wake up and be like, let's go to the gym.
Yeah.
Let's go do this thing, right? First thing in
Yes.
the morning. when you're like, I barely got any sleep last night, and now I feel like I'm just now starting to sleep, and now you want me to wake up at 5:30 or 6 to head to the gym, right? And so I think acknowledging, one, like, you're not crazy, what you're feeling is real. And yes, your inability to get sleep at night and your inability to get good REM sleep, even if you're in the bed by 10, but if you're not getting good REM sleep, you will absolutely still wake up exhausted in the morning, right? It's like, so
Yeah.
we need to be able to talk about it and acknowledge what are the real barriers for being able to feel better, and how can we start to address those so that you can wake up in the morning, feel good, and do whatever it is that you want to do in your day. It
Yeah.
can be hard.
It can be really hard. I really hear that and understand that. And as a patient myself, there's a lot there. Um,
Mhm.
One of the things that we hear a lot about, and it's one of our rules in the community, that it's just not, we're not allowed to talk about it, and that is compounded hormones and the danger that they bring into this. Many people bring it up under the, sort of, this is a natural way to handle it. And can you talk a little more about that from the physician's perspective?
Yeah, I think from a physician's perspective, it's just hard for us to tell you what is in that compounded substance, right? It is, and that is what makes it less safe in our eyes. Even if I write you a prescription and you go to get it compounded, even in that same compounding pharmacy, there is no standard way that it is made, and there is no oversight um, about what is in that product, what is not in that product, how they make it, all of those things. And so that is the difference between what is FDA approved, Food and Drug Administration approved, right? And we
Mhm.
know when I give you a prescription, the Food and Drug Administration has already cleared it. I know what's in it. I know what's not, what is not in it. And it is going to be the same across the United States, right?
Mhm.
As opposed to compounding pharmacies, it's going to always change. There is no standard. And so one time you get the prescription and it's like this, and the next time you get the prescription from that same place and it's a little bit different. So even within that own compounding pharmacy, because they are making it, and we're all humans, and there, of course, is human error. It's kind of like baking a cake, right? It's kind of like, well,
Mhm.
I kind of did this. Yeah, but we all kind of fudge, it's that kind
Yeah.
of idea where it's not going to be very scripted, very standardized, by the book, reproducible. It's just not that way in a compounding pharmacy, and it's not required to be. And so there are lots of room for error, and there's lots of things that can be added that may be harmful. I just don't know. You just don't know. And that is why we are always concerned about the potential of risk that comes with using those types of substances.
Very well said, and thank you for sharing it like that. Absolutely. And it is important. It's important to realize that, going into the hormone discussion, and
Mhm.
hormone replacement therapy is helping millions of people get through menopause and get through what's going on in their bodies. But there's also, it doesn't work for everyone, and there are some limitations,
Yes.
especially as we've been talking about breast cancer this month, breast cancer awareness. And so I was curious if you could kind of share a little bit more on that side, on hormone therapy, and then how that intersects with some risks and some reasons why you may not be able to do it. That kind of goes into some fear, I think, too, around hormones in general.
Yeah. So I think a lot of women, back when the Women's Health Initiative came out, there was lots of looking at that data and this kind of overarching view that hormones were bad, they were going to cause cancer, breast cancer, and the risks of all that outweighed the benefits. And it was like full stop, and people were just like, "Don't give me any of them." And unfortunately, it has taken many, many years and lots of data to kind of unwind what was just thrown out in the popular press. And of course, if people tell you that if they're taking something, they're going to get cancer, people are not going to want to do it. And it's hard to unwind that narrative that was put out there for so many years.
Mhm.
Um, and so I think part of it is trying to let women know, right? There is always a risk. But breast cancer is actually not the number one cause of death in women. And so we are always looking at what are the other things that we are trying to
Mhm.
protect you with and taking hormone replacement therapy, right? And so we are looking at colon cancer and the cardiovascular risks. Heart attacks are a very common cause of death in women, and osteoporosis and osteopenia, and taking HRT, hormone replacement therapy, in the right woman is going to help actually give you longevity, and it's going to improve your quality of life in addition to these other things, right? And so that's why when I
Mhm.
get on a consult call or when you're working with our providers, we're asking all of these things, right? But we're also screening you. Do you have a history of breast cancer? Do you have high blood pressure? Do you have a history of blood clots, right? There are things that are going to put you at risk, and we're going to say, okay, it is too risky for you because these things may happen. But for most women, the data has shown that hormone replacement therapy is very helpful for relieving symptoms, hot flashes, night sweats, mood changes, being able to just help you not have as much brain fog, and being able to just function and feel better in your skin and go through your day, right? And I always tell women it is not 100% for anybody. So when people are like, I tried this, it didn't work for me, I totally get it, right? That absolutely is their experience. And I am never going to tell them no, right? But I also tell women, if you tried one thing, tell me what you tried. Tell me what you did or didn't like about it, and let's talk about other options, because lots of times there are other options, right? It may be maybe the dose was too low, and so we need to give you a higher dose for you to feel the same effects that maybe your friend like said that they were feeling, right? Or
Yeah.
maybe you need a different route, right? There are different ways to supplement your estrogen, and so there are patches and pills, and there are lots of ways to get it. So maybe we need to figure out what works best for your body and your lifestyle. And so I think it's a bigger discussion. It's not a one size fits all. And so when you do anything as a one size fits all, there are going to be lots of people who are like, that didn't work for me. And we have to be able to have that in-depth conversation, find out what are your goals, what how do you want to feel, and if you give us the opportunity to just like work and figure out how we can get the medication dose correct for you, I feel like oftentimes we're able to do that, right? It's not going to always happen that first time around because we try to start you on the lowest dose and then we'll like slowly increase the medication, right? So that may happen over the course of 2 or 3 months. And so you're going to start to slowly feel better, but it's not going to be a one stop shop. And I think there's just a combination of that, of having just a little bit of patience as we go through it to
Yeah.
make sure that we're relieving your symptoms, but I don't want to overload you. I want you to feel good. And it's like, how do we do that?
Yeah, yeah. And that's so important. And I've learned just by working with Gennev and at Gennev that there are just so many ways that you can apply the hormone replacement therapy, and even localized in areas, when we were having that great conversation with Dr. Rebecca Dunsmore Sue and Dr. Lisa Savage, we were discussing that if you have vaginal dryness, you may not take it in a patch form, but you may use it locally there to help. So what you're saying is, we do need to work with someone and kind of troubleshoot through those. What are the problems? What are we actually solving?
Yeah.
One of the conversations we recently had was in the community was around balancing estrogen and progestin.
Mhm.
A couple questions I've got. One, could you kind of talk a little bit about this? Someone was saying you need it to be balanced, and it was, but it's not a one size fits all as you've been describing. Can you share a little more about what that person maybe was thinking? Or
Yeah.
yeah.
Absolutely. So when women are having symptoms, oftentimes it's because they don't have the estrogen. And so what we want to do is then supplement the estrogen. And we also, in women that still have a uterus, because when you supplement the estrogen, there is an increased risk of unopposed estrogen. So estrogen alone in a uterus, there is the increased risk of endometrial cancer. Those women absolutely need to have some progesterone. But there are lots of women who are like, I already had a hysterectomy
Mm,
or, something like that. And so in those women, you will find that they are only taking estrogen. They don't need the progesterone. Some women will still ask for it, and we can have that discussion and talk about the risks and benefits in those women. But you are not required for every woman to have estrogen and progesterone if they don't have a uterus. And so I think that's part of the discussion. Also, I think that sometimes people are like, well, when I was pregnant or when I was trying to
Mm.
get pregnant, my doctor always told me I have to have a balance of estrogen and progesterone. And I'm like, yes, in that situation, again, yes, but that's different than the perimenopausal and the postmenopausal woman. And so I just think it's a conversation where sometimes people have heard information and they're applying it as a one size fits all to every single case. And again, it's not. So that's why it really takes a matter of us discussing what is your history, what are the things that you're looking for, what are we trying to treat, and having to really customize what we're giving you, how we're giving it to you, and what all you need. And all of those questions have to be answered before we can do it.
Yeah. And oh, I love that. So important. So, so important. Can you share a little more too around when HRT gets prescribed or when someone might be able to get into that if they're in peri or post or whatever part of the journey that they're on?
Absolutely. So I tell women when you start having symptoms, you can absolutely begin that discussion, even if you're not ready to commit to medications, right?
Mhm.
And so there are some women who are perimenopausal, so they're still having cycles, even though they may be irregular, but I always tell them, as long as you're having a cycle, there's still a chance that you could get pregnant. And so we can talk about medications and what's going to be the best for you and how we would use it. So again, as soon as you start having symptoms, we can begin that discussion and we can talk about medication supplementation. Of course, when you're postmenopausal, we can start it then as well. And generally, our guidelines are that you would start medication hormone replacement within 10 years of being postmenopausal. So, postmenopausal, you've had a year of not having a cycle. And so we like to do it within those first 10 years because the data has shown that there's an increased risk after 10 years. Most women are going to hit us long before that. And even for the women that are there 10 years out, never been on hormones, there are still options for you. So that's why I always say there are things for everybody. Do not count yourself out just because you're like, oops, I've passed that mark.
Yeah.
Please talk to your provider, get on the phone with the Gennev doctor, because we can still help you with your symptoms and we just need to tailor it. We need to customize it for you, but you do not have to suffer in silence just because a certain deadline or date in your head has been met.
Yeah, so 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 important, and important to verify what you think is real or what you think is accurate in your head. You know, it's interesting that you brought that up about the progesterone and estrogen balance, and that conversation when you have babies is different than now, and it's interesting how those things do sort of live on, and we do have to challenge ourselves
Yep,
to get the right information. You know,
absolutely.
one of the other myths, and I love that you talked about it, or you know, I think a lot of people just don't know is, you know, what is perimenopause and when do you actually hit menopause and what's postmenopause? Can
Yeah.
you touched on it a minute ago, but what are those? What does it mean to be through those?
Yeah. So perimenopause is going to be that time period where you start noticing any kind of menopausal type symptoms. So the night sweats, the hot flashes, the irregular spotting is usually, or the irregular menstrual cycles is what people will start noticing. But you're still having menstrual cycles, so that can last, 10 years for some people, where they're
Mhm.
kind of off and on. But they are still having enough hormones in their system, enough estrogen and progesterone, that they are still cycling and could still get pregnant, even if it's very irregular. Postmenopause is when you've gone through menopause, is when you have not had a menstrual cycle for a year. And for some people, it then is hard to know, right? Because some people, they may be on an IUD, and so
Yeah,
they don't have a cycle at all. And so they're like, how am I supposed to know? Or maybe they're on birth control, right? And
yeah,
because you're taking medication, it either stops you from having a menstrual cycle or it causes you to have a regular cycle when naturally your body would not. And so it is hard to know if you are on some kind of medication that changes your cycle if you are or are not postmenopausal.
mhm,
And of course, postmenopausal is after you've already had a year of not having a cycle. Um, for us, it is less of a matter of that. We really will treat you based on your symptoms. And so when people come and they're like very concerned about what are my hormones? Do I need to get levels checked? I'm like, we don't treat lab work because we know that depending on the time of the day, depending on where you are in your cycle, that cycle month, those lab values are going to fluctuate wildly. And so when your doctor's like, oh, that's okay, I can just give you a medication or we don't need to draw blood work, that is why. It's not that we're not interested. It's just we know that if we take it at 3 p.m. today, it's going to be completely different than 2 a.m. tomorrow or 10 p.m. tonight.
So
And so it just makes it more confusing. But if you come to me and say, I'm having hot flashes and night sweats, I feel horrible, I'm having brain fog, and I am interested in medication, we can move forward. I don't need a lab value for me to treat your symptoms and help you feel better.
yeah, yeah. And you trust the patient and what she's
Yeah,
going through, and you're hearing that,
absolutely.
and,
Yeah,
and I have, I'm definitely in peri, I'm 47, and I have younger friends who are like, I think I'm, and it's like, yeah, you likely are going through something, you're feeling it,
yeah,
you're not crazy. These are real things, and I love that. It's, every once in a while we'll get in the community, someone's like, I was at 11 months and then I got a period, and it's just like,
I
oh
know.
no, now I have to start
I'm
all over,
starting
all
over.
these things. Yeah, it's just, and I'm like, oh gosh, um,
Yeah. And one thing I'll tell you for women that are interested in having more information, one of the things that Gennev does provide is that menopausal assessment, completely free. It's the questionnaire. And so it's a great way for you to take, I think it takes like maybe 10 minutes to take the questionnaire completely free. And then you will get a whole printout about kind of where you are in your menopause journey. I think it's good just to give you more information, right? Because it kind of tells you based on what you've answered, this is kind of where we would say you probably are in your menopause journey, how much longer it may take before you actually hit menopause. And it gives you just some information if you want to use that to then not only educate yourself, but when you go in to see your provider or your doctor, hop on the phone, you can be like, I've already kind of assessed some of these things. These are the symptoms. And now it makes it easier even to start that conversation and be able to advocate for your health. So for women that are just kind of like, I'm not sure, that's a great place to start. And getting on our website gives you lots of information once you've taken that assessment.
yeah, so important. Thank you for saying that. Go to gennev.com and take the menopause assessment. I put it into our chat so you can quickly get to it. And you could also set up an appointment with Dr. Dooley herself. So, that would be amazing too.
Yes.
You would be lucky to be able to work with Dr. Dooley. We do have a question in the chat from Jody. How long can menopause last? Another great one.
Yeah. There is no specific timeline. So I have talked to women who are still going through, so usually people are like, how long does perimenopause last? Or when are they going kind of before they're actually like completely postmenopausal? And that can last like 10 or 15 years because menopause is going to be after you have stopped, having your menstrual cycle for a year. And so that will go on until, you die. But for most women, they're kind of like, how long am I going to be in that perimenopausal phase, or how long will I have menopausal symptoms? Because just because you stop having a cycle, right, at, I don't know, say 51 or 52, it does not mean that you're not going to continue to have symptoms of the hot flashes and the night sweats. And that can go on for many people 10 years, 15 years. And so that's where we're like, you know what? You just because you've already stopped your cycle doesn't mean that we can't continue to help you feel better, to help you alleviate your symptoms and
Mhm.
do that either with or without medications. But it can go on for quite a while. So I never tell people, oh, once you've stopped your cycle, all these other things are going to end in a year or two. Highly
Mhm.
unlikely for most people.
Yeah. Oh, we just got someone, Carol just shared, she's been going through 10 and a half years for her so far with symptoms.
Yep.
It's no joke.
Very
It's no
common.
joke. Yeah. Yeah.
Very common.
Yeah, very, very. In our last myth, the last thing we wanted to bring up, and there's so many more. We're going to continue to do these, listener. We're going to keep bringing these up and bringing Dr. Dooley on and other Gennev doctors to continue to talk about all of this. But one of the ones that we see a lot is I'll never be myself again. I'm never going to get through this.
Yeah.
Can you shed some light a little on that, Dr. Dooley?
Yeah, absolutely. I always just tell people you are just going to be a different version of yourself.
Hmm.
It is really hard if your goal is to be like your 30-year-old self or the self that you were before you had babies or whatever, right? Because it's almost impossible for all of us to become that person again, right?
Mhm.
Our metabolism has changed, our lifestyle has changed, what we are doing day to day has completely changed. And so if you set an unreasonable expectation of I'm not going to be happy or I'm not going to feel good unless I can look like I did when I was in my late 30s or early 40s, or unless I feel that way or I have that same weight or whatever, yeah,
Mhm.
it's going to be, you're probably not going to be very happy, right? But I just tell people, what is the new version of you right now that works for you, right? Especially if you have a spouse or a partner or you have kids, probably whatever you're doing day to day, your day looks different, right? And so you have to be able to say, given all of my, current responsibilities, how
Mhm.
much I can work out or want to work out, what my day looks like, how can I be my best self right now? What does that look like? And how can I
Mhm.
feel maybe even better than I did in my 30s and 40s? Because now I'm like putting more priority and time on me in a way that maybe I didn't have a chance to do when I had little kids in the house, or even, young adults in the house, and I was really busy trying to take care of them. So I think we just have to be able to reimagine what it looks like in perimenopause and menopause. And sometimes that is just having a community of women like we have in our Facebook group, just really
Mhm.
normalizing, right? Like, you're not crazy. It really does suck when you're not getting any sleep. You wake up irritable and it's hard to just
Mhm.
function and go through your day, right? It's like, okay, so what do we need to do to feel better knowing that all of these symptoms are going on, right? And sometimes people are just like, just knowing that somebody I can talk to
Yeah.
gets me and hears my symptoms is fabulous, right? You're like, okay, it's not just me. And then for some people, they're like, okay, now what can I do, right? Do I need to meet with like my doctor and say, hey, what are the things that I can incorporate? Are there some lifestyle changes that I can do that are going to help me feel a lot better and give me more energy, those natural endorphins, that natural high? Do
Yeah.
I want to do, medications that help me just to be able to sleep better and have less brain fog and be able to function, be less irritable during the day? There
Yeah.
are so many ways that we can manage that. And so I just want you to know, like, there is no one stop shop, but whatever it is that you want, we can get you there. And it's just a matter of like, what are the things that you're willing to do? Right. And I always say it's really simple, right, to do it. It's not always easy though, right? Because if it
Right.
is, now I want to be able to exercise every day, that's a simple thing to do. Not always easy though when your
No,
alarm is going off at 5 in the morning.
no, it isn't. No, it isn't. That's so true. One thing I think that we all need to do is lean into that second half, and
Mhm.
one thing I love about getting older is the wisdom that comes with it. And even the ability to ask myself those questions. What is it do I need? I didn't do that as a young mom, as a young woman,
Yeah,
as much as I'm doing now. I think I'm really cultivating that. And we deserve to cultivate that. It's powerful to do that. Um,
absolutely.
Oh, thank you so much. I think we could
Yeah.
continue talking for a very long time. But thank you all so much for joining us today. Thank you to Dr. Dooley. You are so awesome. You're such a wealth of knowledge. I so appreciate you spending your time with us.
Of course.
Community and listeners, FYI, yes, you can schedule an appointment with Dr. Dooley if you'd like to work with her or any of our amazing MDs. We have MDs in all 50 states and
Mhm.
registered dietitians and health coaches in all 50 states. I wanted to just do a quick plug for next week. We are going to be talking about blood sugar and menopause and the intersections there all month next month. It's Diabetes Awareness Month. And that is a big conversation for us to have as it relates
Yeah.
to menopause and all of our journey going through that. One last thing, I'm here to remind you, you do not need to do this alone. As Dr. Dooley was saying, join our Facebook community. It's called Menopause Solutions by Gennev. There's over 8,300 women and people with ovaries in there. And they do truly see each other. It's one of the
Yeah.
beautiful parts of that community, because it's just lovely to watch that. There's also medical treatments and lifestyle treatments and great expertise for you to tap into. Go to www.gennev.com to book your appointment today and to check out our Learn section, full of free information, fantastic information to help you. We have doctors and health coaches again in all 50 states, and you can get connected usually within 3 to 5 days. Ladies, it's completely, totally worth investing in yourself and in your quality of life.
Mm.
Um, Wonderful. All right. Thank you. We'll talk to you next week.
Sure.
Bye.